When a patient comes in, they often ask about Botox and filler in the same sentence, and that's because these products are often discussed together and the patient may not understand what is used for what. So Botox is used crow's feet, frown, forehead lines, so generally from the eyes up. There are some exceptions where we'll use it in the lower face, but it's not the norm. Fillers, on the other hand, replace volume from the cheeks and lower eyes down. So they're very different products. I've had a patient yesterday come in and say, I need Botox right here for these lines. And I explained to her that we really don't want to stop movement creating these lines, or you're not smiling and moving your face normally, but that we want to lift these lines with filler. And also people will ask, well, how much downtime is there? And generally there's no downtime with Botox. While it's always possible to cause a small bruise anytime we place a needle into the skin, it is not the norm to have bruising. It can happen as a rare exception. And it will usually take 7 to 10 days for the Botox to kick in. It's a gradual onset, and so new patients will come back at 2 weeks so we can make sure we've achieved the desired result. Facial fillers are often paired with Botox, and fillers are meant to restore volume, smooth lines and wrinkles from underneath, and help shape and contour the face. As the face ages, volume in the cheeks tends to drop, creating jowling, nasolabial folds, oral commissure lines, the lips lose volume, tear troughs become more noticeable, and filler can be used to address all of those issues. The fillers that we use are hyaluronic acid, which is a substance that's found naturally in our body, in our skin, connective tissues, and joints. The products are created in the lab. They're not animal derived. They are delivered to us in a sterile pre-filled syringe. So you purchase a syringe of filler, and the amount that we use is determined on the end result that we're looking for and how much correction is needed. We use Restylane quite a bit, as well as Juvederm, and they were the original hyaluronic acid fillers that were in common use. They last up to a year. Having said that, sometimes patients will come back after 6 months and say, I need more, and it is simply volume dependent. And some people will seem to use their filler a little bit more rapidly. Areas around the mouth, for example, that move a lot, the filler may be absorbed a little more quickly. Having said that, I've seen patients who had their filler in their lips 2 years ago and it still looks fantastic. So there's a lot of individual variation in how your body uses these products. But if you feel like you don't have enough correction, it means we simply want to place more volume. And often we'll do it gradually so that you have a slow and gradual improvement and nothing drastic. And other times we'll go for broke and take care of everything all at once. Voluma is a volumizing filler that is a cousin of Juvederm. It's Juvederm Voluma, and it's also hyaluronic acid, and it's been specially formulated to last up to 2 years. Voluma is the only product that is approved for the mid-face volume replacement. So we use it a lot in cheeks, the mid-face that tends to flatten. We also have found we can use it under the eyes and everywhere else on the face. Juvederm, Voluma, Restylane are all injected through quite a small needle. You can have bruising, although again, most patients are fine and able to go right back to work or out that evening. You can have some swelling, and so I'll often advise patients to sleep with their head elevated and to avoid salty foods that first day or two. If you do have swelling, it's going to be temporary. Cool compresses and elevation will help it go down.